Okay, we're back. So, injection guidelines. Always work in a quiet and well-lit atmosphere that is free from distractions. Okay. Always ask if you have a question about the medication order. So ask the ordering provider. Don't just guess. Don't go, oh, I'll figure it out later. Always ask the questions first. You need to be familiar with the drug that you've been ordered to give, okay, and know the abbreviations for it. You should know any common side effects, all the things, right? If you're ordered to administer something that you are not familiar with and you've never given before, which is going to be the case when you guys are first getting out there, stop and look it up, get to know it, right? Grab a PDR, physician's drug reference. Most of the electronic medical records where most of your orders are going to be coming through will have links in there, like a lexicomp where you can look up the drugs. Okay. Always perform hand hygiene before preparing, administering, and after giving your injections. Okay. Always prepare all medications using medical aseptic technique. Okay. And I just want to go back to number 1 here. Most facilities will have a designated area with big signs that says quiet, quiet med prep area, something like that. And it's kind of off, hopefully, not in a high traffic area, because the studies have shown that most mistakes occur when people are preparing a medication and they get distracted or they get rushed because there's a lot going on. It's busy, it's a busy urgent care or something, or their coworker comes up and starts talking to them, asking them about patient in patient room 4, but they're preparing a med for the patient in room 8. Get confused, mistakes happen. So hopefully where you go to work or do your externship will have a designated area. Quiet, lots of good lighting, free from distractions. Okay. Make sure you always select the proper drug according to the order, right? We're always going to do 3 checks of the drug and make sure it's the right one. If you're not sure, ask. Okay. You're always going to check the expiration date, right, before preparing the drug. Make sure it's not expired. Don't use it if it's expired. Don't use it if there's a missing label or if it's difficult to read, if it's been like scratched off. You're going to inspect the color of the medication as well. If it looks off, might have gone bad. If there's any precipitate in there, anything chunky, floating, anything that looks unusual, strange odor, don't use it. It's really important that you prepare the proper dose of the drug, right? That you administer the exact dose that's ordered. You make sure you check that 3 times. And then you should label the injection with the patient's initials, the name, the dose, manufacturer, lot number, expiration date. Yeah, a lot of ones are kind of nice. They'll have little stickers with that information on it, so you can just grab it. But yes, you will need all of that information in order to document in the patient's chart once the injection has been administered. Okay. You're going to go to the room, the patient's room, sanitize your hands, right? Ask the patient to state their full name and date of birth. Now, let me backtrack just a step. Okay, so if you are giving a single, if what you're giving comes in a single dose, a lot of flu shots come already drawn up and prepared in the syringe. It's amazing. It's so wonderful. Okay, so all you have to do is go grab it, take it to the patient's room, done, right? You don't have to draw it up or anything like that. Okay, there are some that come in single dose vials, right? You can take those into the patient's room and prepare it there in front of them, all right? Multi-dose vials, so anything there where there's enough doses in there for 10 patients in the vial, those always have to stay in the preparation area where they are stored. Okay, you cannot ever take a multi-dose vial into a patient's exam room. It's now contaminated and no other patient can use it. Okay, so those you prepare in your quiet, well-lit area. Single doses you can prepare in the exam room in front of the patient, okay, as long as your site policy supports that. I actually prefer to do that, but it's, there might be policies. Just check that. Okay. You're going to check the patient's medical record. You're always going to ask them about any allergies, right? Any allergies to drugs, immunizations, anything like that. And you're going to check the record too, because people forget. So some people don't even know, like pediatrics. You're going to determine the appropriate route and site. Okay, so the order should have specified what route you're going to use, or if it's a flu shot, you know what route to use, right? It's an intramuscular. If you weren't sure, you didn't know, check the product insert, right? It'll tell you. It'll tell you the appropriate route to use, and it might even tell you what site you should use, okay, to administer the injection. So make sure you know what you're doing there. You're going to prepare the patient's skin, right, usually with an alcohol prep wipe. Apply clean, disposable gloves, always, always. Administer the injection using proper technique. Lock out the safety, dispose it in the sharps, okay? Attend to the patient. Sometimes the little blood comes out, okay? You're going to put gauze on the blood, put a little bit of pressure on there, make sure it's done bleeding, put a Band-Aid if they want it, okay? Make sure they're okay. Oftentimes, you're going to have them wait for 15 minutes before they leave to make sure they don't have a reaction, okay? And then you're going to immediately document the procedure, right? So that your timestamp is there and you're going to document all of the information. Okay, so we always perform 3 checks. Okay? Anytime we're giving a medication, immunization, anytime we're giving anything to a patient that they're putting in their body, you check it 3 times. Okay. First time you're going to check it is when you take it out of the shelf or out of the fridge, wherever it's stored. Okay. You're going to take it, you're going to look at it, you're going to check it against your order. You're going to make sure that the name matches perfectly and the appropriate dose matches perfectly, or amount, milligram strength. Right? You're going to check the expiration date and you're going to check the integrity of the medicine itself, like we talked about, color, clarity, the vial, make sure it doesn't look tampered with. Then you're going to take it to the area where you're preparing it, okay? And you're going to check it again. So before you draw it up, before you mix the diluent in, you're going to check all of those things again, every single one, okay? Checking the order, making sure that it matches your patient's name and the medication. Then you're going to prepare it, right? If it's an injection, you're drawing it up. If we were giving an oral medication, right, you're pouring it out into med cups, something like that, okay? And then you're going to check it again, right? And so if it's a multi-dose vial, you're checking it a 3rd time before you put it away. Always do your 3 checks. If you do that, most of your mistakes will be caught, okay? Same with the 7 rights, right? We always want to follow the 7 rights, okay, each time we do a check. So we're checking all 7 of these 3 times for 3 checks. Okay, so we always want to check and make sure we have the right patient. Are you John Doe? Okay, good. My order is for John Doe. Okay, we're always going to check the dose. All right, okay, I'm giving 1 milligram. The order says 1 milligram. Okay, is it the right drug? Right, this is for, I don't know. What would we get? Flu shot, right? Influenza vaccine, okay? The order's for an influenza vaccine. This is an influenza vaccine I'm holding here that I'm going to give, okay? Is it high dose, right? Make sure, okay? Check the right route, all right? Make sure that the order and then the medication that you're giving, the route indicated, is what you're going to do, okay? What you're getting ready to do. And the right route also includes that you're using the right technique for that route, okay, which is what you'll learn in lab. Make sure it's the right time. Okay, so this means that if you're giving a vaccine to a pediatric patient, you're responsible for checking and making sure that it is that they're correct age, right? So you're going to have the charts from the CDC as far as the correct age when they can receive those vaccines. Okay, don't just rely on the provider. You're the one giving it. So you're the one who's ultimately responsible for it, right? You could catch a mistake that the provider might make. Okay, if it's vaccines that are given in intervals or medication that's given in intervals, such as what's the depot, right? The birth control injection, right? Depot, I think we give every 3 months. Okay, you need to check and make sure, when was the last time this patient got it? Is it the appropriate time interval, right? Make sure it's not too soon or too late for the vaccine, in which case call attention to it to the provider. Okay, checking the right time also means checking the time on the drug, right? Making sure that it's not expired. Okay, and then our last one is making sure that we document it correctly. Okay, so my little mnemonic for the 7 rights, because you should always have these memorized, is patients do drugs round the day. Okay, patients, the right patient, do, dose, drugs, drug, round, route, the, time, day, documentation. So it's PDDRTD. Patients do drugs round the day. Okay, hopefully that helps you remember it. Come up with your own if you like. Okay, so we might be documenting on paper. Okay, we're definitely documenting electronic. Pretty much every facility you go to should have electronic medical records. And then you might be documenting on an immunization card like this. I have one like this. People old like me have these. But make sure you do it. Make sure you're documenting the date and time given, the name of the medicine, the dose that was given, the route that you gave it through, the site that you used, right? You always want to document left deltoid, right deltoid, left forearm, right forearm, okay? However, wherever you administered it. The manufacturer name, okay, it's going to be on the medicine. The lot number, every single medicine has one, okay? The expiration date, you need to document that, okay? Any unusual observations, any unusual patient reactions, you're going to document, okay? And your name and title, right? So Hannah Forbes, certified medical assistant, you're going to make sure that you document that as well, okay? Now, a lot of electronic medical records will automatically, put in your name and title on your documentation. They'll automatically date and timestamp, right? Which is very handy. But you always need to make sure you're documenting all of these things. If you didn't document them, they didn't happen, okay? If your patient has a reaction later on, the lot number, expiration, manufacturer name, these are going to be very, very important to track, right? And it's very, very important to protect yourself as well, that you can prove that you gave the correct medicine, okay? So patients don't try and blame you, say you gave them the wrong thing. Okay, and we're always going to document the VIS that we gave to the patient and the most current date of the VIS that we gave them, right? The dates, it'll be printed on there. Okay, and we're documenting the date that it was given to them. Should be the same date that we're administering the vaccine, right? That would make sense. Okay, here's an example of how you would document on a paper chart. Okay, you have your date, you have your time. This was an MMR. And it was 0.5 mLs, so that's the dose, route, sub-Q, site, right upper arm. The manufacturer was Merck. Here's the lot number, here's the expiration date, how the patient tolerated the procedure. The VIS with the date on it was given to the patient, right, on this day, with your sign-off, okay? Initial of your first name, comma, last name, comma, your credentials. In here, you will be SMA, right? Student medical assistant. Okay. Thank you. I think that is the end of injection basics. We'll see you next time.